Well, warm welcome to this talk. It's Tuesday the 17th of January in a cold north of England. Now, I want to start off by looking at the symptoms that we're getting at the moment as of Tuesday the 17th of January in the UK from COVID, according to the Zoe Health study, what was the COVID symptom tracker study, now called the Zoe Health study. So let's look at this here. Now, what we see is that the symptoms we're primarily seeing are those of a common cold. People are feeling generally unwell with common cold type symptoms. COVID is still making people ill and people are still going to hospital with COVID and from COVID. But it tends to be mostly exacerbating existing conditions. Thankfully, we're not seeing the COVID pneumonias that we saw in the earlier waves of the pandemic. So let's go through these now. Now, these are based on self-reported symptoms, but they are collated to be with positive tests. So we know that these are COVID symptoms as opposed to symptoms of something else, which of course is very important. And we see that 58% of people that are testing positive have got a blocked nose. Now, I'm sure we can all relate to this. Common cold symptoms, we get it all the time: runny nose, blocked nose. So blocked nose is currently the most common symptom that people are reporting, 58% of people who test positive. Sore throat, it's 56. Sore throat's been quite common during the Omicron period. Then a runny nose is the next feature. Again, very typical chroizal common cold type features. Headache, 51% get headache. Cough with no phlegm. So cough with no phlegm is that kind of irritating cough, but you're not producing any sputum. So it's a sort of what we might call, I used to call them, well, I still do call them dry coughs, really. So cough with no phlegm, about half of the people who are infected get that. Productive cough, about 44%. What often happens with infections is you get an irritating dry cough first, and then the productive cough comes on as your cilia are clearing out all the mucus and infection from your airways, which of course is perfectly natural. Cough is an absolutely essential defense mechanism. People that can't cough will get pneumonia. So you see people with tracheostomies and things in hospital, they can't cough. So we have to do fairly elaborate procedures to keep their airways clear because they can't cough, so they can't clear their airways. And if you don't manage that, they'll get pneumonia. So all these things like cough and diarrhea, although they're inconvenient at the time, they are essential protective mechanisms, getting infectious material and unwanted material out of the body. Sneezing, also very common, 50%. Hoarse voice, indicating the vocal cords are probably somewhat inflamed, in 42%. And again, these are all very much upper airway features, not the lower pneumonia type features. These are affecting the upper airways, the nose, the mouth, the pharynx, the upper part of the airway, and the pharynx, the nasopharynx, the oropharynx, and the laryngopharynx, connecting all the tubes behind. Muscle pains is a more systemic feature, so you generally feel achy. 25% are getting that. And we do see that the systemic features are getting much less common as time has gone on, as more and more people are developing natural immunity. The upper airway features are there because we're getting these reinfections, as we've looked at recently, but thankfully much less of the lower airway pathology. Muscle pains, fatigue, 22%. Altered sense of smell, that one's gone down a bit lately. Dizzy lightheadedness, anytime you don't feel well, you get this dizzy lightheaded. You just want to lie down, really, and opt out of the world for a day or two. Loss of smell, down to 19%. And the swollen neck glands, these are the lymph nodes that you get in the neck, swollen, indicating that the body is dealing with an infection. In this case, SARS coronavirus 2 infection, but mostly localizing it to the upper airways. Lymph nodes are absolutely brilliant because they tend to localize infection. So like if you get an infection in your hand, you get swollen lymph nodes under your arm, and it tends to localize it, and most times the infection won't spread into the rest of the body, causing sepsis. Very great localizing mechanism, the lymph nodes. Shortness of breath, which was one of the frightening features earlier on, of course, now down to 16%. So very fewer people getting shortness of breath. Chest pain, tightness, still 15%. Quite what's causing this is not clear, but we do, of course, get chest pains during infections. We have to differentiate this from severe cardiac-related chest pain. So if you get severe chest pain, that's central chest pain especially, if it goes up into the neck, even into the lower jaw, down into the epigastrium, often into the left shoulder, down the left arm, occasionally to the right shoulder, very occasionally into the right arm, that's a potential cardiac symptom, and that's basically a medical emergency. But the aches and pains, still disconcerting for a lot of people, but anyway, 15% of people get that. And we believe the majority are not cardiac, thankfully. Earache, 14%. This is not surprising. There's a tube goes from the pharynx at the back through to your middle ear, the eustachian tube. I think it's now called the pharyngotympanic tube. The eustachian was the guy that first discovered it, so we tend to call things by the anatomical positions now. Anyway, it's connected, so it's not surprising you can get earache from the middle ear, causing a degree of otitis media. And very often what you get in the ear, you can get an initial viral infection, then you get a bit of bacterial secondary infection. Usually, although the otitis media is caused by bacteria, usually antibiotics are not necessary in that condition. It's usually self-limiting, and antibiotics are of little help in most situations with people with otitis media. I'm going to show those in a minute. Didn't mean to click that. Where are we? There we are. Again, systemic features, chills and shivers, 12% down to 12%, and wheezing, 11%. People that are prone to asthma are more likely to get wheezing. And of course, these symptoms shouldn't be minimised. Asthma is a potentially dangerous condition, and of course, people still die every year from asthma. But most people that have asthma have their own inhalers at home and are aware of when they're becoming more ill. So what I've often done with those features is I've tended to tag them onto the end of a video, which not many people watch. So I thought I'd put those in a separate video so that we know what the current features of SARS coronavirus 2 infection are. This is how COVID is currently presenting for the vast majority of people. And it is a huge number of people at the moment. About 1 in 25 people have an active infection in the UK just now. This is very endemic, and these are the symptoms that we can expect. Reinfections are going to cause similar reinfections with the current variants are causing these similar symptoms. Well, these are up to date, as we've said, as of 17th of January. So these are the symptoms that we are currently seeing. There's some differences from earlier stages of the Omicron wave, but not really significant, these upper airway symptoms. So I think I'll just leave that there. Have a high index of suspicion for these symptoms if you've got it. If the tests are still available, you can buy tests to test, and then you can behave accordingly once you know more definitively what your current SARS coronavirus 2 status is. So I'll leave that today. I'm just going to show you, as you see from behind us, we've started doing posters. Now these posters are all based on high resolution pictures, so you can actually download them. They're all copyright free. We've put them in the public domain. And there's a few more you can download that I was going to show you before. As you know, we're not happy with the current level of freedom of speech. In the United Kingdom, there seems to be a narrative that is pursued. While that's got validity, we can analyse that, but we want to be much more free than we are to discuss other narratives. So we've put that one there, I think, when I'm allowed. And that's the Ring of Brogda in the organ. As you can see, the high resolution pictures. So you can download these completely free, and you can print a copy and put it anywhere in your house you would like to. Just show you a couple more. Turn, look and see. Do we need to be more perceptive of that which is around us? Illustrated by some Cumbrian sheep. I like the picture. That's the main reason I did it. Now, more importantly, more seriously, this is the one from our community health project in Uganda. Kids' Lives Matter, the group of kids in one of the villages where we're currently distributing mosquito nets. We've just bought, thanks to mostly your generous donations, we've just bought 1,000 mosquito nets, and we're distributing those around this area. So feel free to download those, and they are in public domain, and those children did give permission, and we did get permission from all of their parents to be in the picture. So it is a fully authorised ethical picture. picture. And as you can see, they're all quite happy to be there. So quite a lot more to discuss, but we'll leave that one as a short video for now. Thank you for watching.